A study of the female athlete triad, written and presented by Anna Grzeszczak for Professor Finch's medical terminology class. Let's begin with a description of what the female athlete triad entails. The NCAA states that this condition is marked by the presence of three distinct and interrelated components: low energy availability, menstrual dysfunction, and impaired bone health. This can be seen on the figure to the left. The first component is an energy deficiency. The ACOG states that optimal energy availability results when dietary energy intake minus exercise energy expenditure leaves adequate energy for remaining body functions. Therefore, energy deficiency occurs when the exercise energy expenditure is greater than the energy intake. This is often due to a coupling of excessive exercise and inadequate food intake, but it may also be due to restrictive eating habits or eating disorders such as anorexia, bulimia, and binge eating. The second component of the female athlete triad is menstrual disturbance. This is marked as consistently irregular menstruation cycles. The NCBI breaks this down into primary amenorrhea, which is the delayed age of initial menstruation, so past the age of 15, and secondary amenorrhea, which is the loss of menstruation for 3 or more consecutive cycles, the more typical of female athletes. Disturbances in menstruation patterns are often caused by inadequate nutritional intake, but also are coupled with low levels of estrogen, high levels of stress, and increased growth hormone levels. The third and final component is low bone density. OrthoInfo states that this is a disruption in the bone building process that leads to weak and brittle bones. It can also be called premature or an early onset of osteoporosis. This too is due to inadequate nutritional intake, specifically when low levels of calcium and vitamin D are present, and is also due to low levels of estrogen. So now that we've talked about what it is, let's talk about the associated symptoms. Because there are 3 different components of the female athlete triad, there are 3 various categories of symptoms. Stacy Sims, a nutrition scientist, states that the female athlete triad affects many aspects of physiological function, including metabolic rate, menstrual function, bone health, immunity, protein synthesis, cardiovascular, and psychological health. For the low energy availability component, typical symptoms include bradycardia, hypotension, hypothermia, weight loss, fatigue, lightheadedness, and changes in mood. Menstrual disturbances are coupled with delayed menstruation or completely absent menstruation, which is amenorrhea. The low bone density component results most often in stress fractures, but also deals with increased recovery times from injuries and early onsets of osteoporosis or osteopenia. Building off from the symptoms, we must talk about the prevalence of the female athlete triad. The Children's Wisconsin Hospital states that the condition is more prevalent in athletes of sports that emphasize a lean physique for a competitive advantage. Some of these sports include long-distance running, gymnastics, figure skating, diving, and dance, although there are plenty more. However, if we think about the root of the problem, which is inadequate nutritional intake, it is made clear that any female athlete with insufficient energy supplies is at risk, no matter their body size or sport. With such a high risk of prevalency among high school and collegiate level athletes, it is important to talk about the diagnosis. And even more so, that it is difficult to make that initial diagnosis as it is a product of related problems. Because it is so challenging to discover all 3 components, it is crucial that when a female presents one of the 3 conditions, that screening or testing for the other 2 conditions should follow. The NCBI states that screening should include an analysis of patient history with questions pertaining to physical activity, past injuries, diet, eating behaviors, and menstrual history. In addition to discussion with the patient, further examination and testing may follow. For the low energy availability, complete blood count levels might be checked, as well as physical signs for rapid weight loss. Menstrual disturbances include a urinalysis to reveal pregnancies or hormonal imbalances that could be causing the same symptoms. Low bone densities use tuning forks to assess the presence of a stress fracture, which can then be confirmed by X-ray or MRI readings. Although the diagnostic procedures differ for each of the three components, the treatment for each is relatively the same. It all stems down to a team effort. This is not just a job for the family physician. Optimal care includes the support of multiple professions, including the gynecologist, athletic trainer, coaches, nutritionists, psychologists, family, and even friends. The main solution is a lifestyle adjustment, which is based on proper nutritional intake and reduction in stress. In addition to those, the energy deficiency component benefits from decreased volume and intensity of training. Menstrual disturbance benefits from weight gain or hormonal therapy using contraceptives, and low bone density benefits from calcium and vitamin D supplements. For all three conditions, progress is measured by regular reassessment of symptoms. I'd like to conclude with the top warning signs for the female athlete triad. The Mayo Clinic states that these include a decline in performance, weight loss, mood changes, frequent illness or injury, stress fractures, and/or dissatisfaction with appearance. It is very important for young female athletes and their coaches to be familiar with these warning signs. Sacrificing one for quick success in competition is not worth the long-term health risks that accompany it. By paying careful attention to your own and your teammates' nutrition and sleep and stress levels, we can decrease the prevalence of the female athlete triad, a vital change needed by our female athletes. And that's it. Thank you so much for listening.